This video is presented by the Denture Relief Clinics of America, a nonprofit organization whose mission is to educate those suffering from issues related to dentures, partials, and missing teeth about the many new alternatives now available to them. Do you know the real truth about having better fitting, stronger, and more reliable teeth that won't pop up, fly out, or get stuck when eating? Since you responded to our ad that offered to tell you, you've probably realized that you may need some help and some good advice with your dentures. And let me tell you that knowing how to make the right decision about what you need is just as important as realizing there are more options out there for you instead of just struggling along with agonizing and frustrating dentures. Because selecting the wrong dentist to help you with your teeth can mean the difference between enjoying eating, talking, and laughing and experiencing a ton of headaches, frustrations, and unnecessarily depriving yourself of some of the simplest pleasures in life. You see, if a dentist is not really on the ball and hasn't gone through the correct trainings that are out there, or has more to gain than you do, or is looking out for their own best interest instead of yours, look out. I'd like to give you an example of a couple real situations so you can see what I mean. Helen was a very nice woman who realized that she was going to need to get the rest of her teeth pulled. When talking to her dentist, he told her the only option was to get a full mouth of dentures. Helen had just turned 60 and was the picture of health except for the missing teeth. She was very positive and optimistic about life and was willing to do whatever it took to get the best treatments for herself. When Helen asked her dentist, "What about dental implants? A couple of my friends have them and they seem to really like them." The dentist took a deep breath, acting frustrated by such a question, and replied, "You don't qualify for such a procedure, Helen." Trusting her dentist, she went ahead and had the dentures made for her. Helen absolutely couldn't stand her dentures. She found that every time she went out to eat, she noticed that there were certain foods she couldn't eat, such as apples and certain vegetables. Every time she went to laugh, she felt as though she had to put her hand over her mouth, all because of the fear that they would fly out on her or move around. She was so sick of using gobs of denture adhesive, gagging uncontrollably. She has loss of taste and she's tired of having sore spots in her mouth. Even the foods that she could eat didn't taste as well because the dentures covered the roof of her mouth, which is where your taste sensations are. Here's how it all changed. So 5 years went by, and Helen was reading in a local newspaper how there were new procedures that could assist people with dentures. She went ahead and came in for a free initial consultation, only to find out that she has always been qualified to have dental implants. She found that her dentist she was working with didn't give her the correct advice because he wasn't trained in assisting people with dental implants, and he would have had to send her to another dentist, something some dentists don't like to do. In other words, Helen just spent the last 5 years plus all the money on her dentures only to have to deal with all the problems, frustrations, worries, fears, and embarrassing thoughts that come along with dentures because her dentist wasn't looking out for her best interest. Now, while Helen came in and got help, there are many others who never find out their options, or when they do find out, it's too late. For example, Helen had a friend named Rita. Rita had gone to the same dentist and had the same procedures as Helen. When Rita came in, she was very excited and happy because she thought that dental implants and having stronger, more reliable teeth was going to be her savior. But the problem was that Rita had too much bone loss due to the dentures, and she was no longer capable of getting dental implants. However, if she came in only 1 year earlier, we would have been able to give her the teeth that would create the feeling of confidence and being attractive that she hasn't felt in the 10 years of wearing dentures. While we were still able to give her some help with her gums and with the fitting of her current dentures, it was nowhere near the level of comfort we could have given if she'd just come in 1 year earlier. Believe me, this kind of story can break your heart. It's apparent that she will always regret trusting and accepting a treatment plan without being educated about her options. The thought of a beautiful, confident woman like her forced to make an unwanted decision is very sad. Have you ever known anyone who has gone through a similar problem? Maybe a friend or a family member. Can you see yourself in this situation either today or sometime in the future? Please take note. You are responsible for being educated about your options when it comes to your dental health. You must take the steps necessary to assure yourself of a dental future that is far better than the one just reviewed. My goal with this video is to show you how you can have a stronger bite with more comfortable and confident teeth quickly, easily, anxiety and pain-free, guaranteed. Many former denture sufferers are now telling us how they're eating and truly enjoying the foods that they haven't been able to eat for so long. They're actually tasting the foods they're eating, and they don't have to mess with gobs of denture adhesive. And they're excited how their lives have changed because of their new dental implants. Hi, my name is Steve Moran, founder of Denture Relief Clinics of America, and we specialize in educating seniors who are currently wearing dentures about getting a more comfortable, enjoyable, stronger bite through the revolutionary advancements in dentistry. In this video, my purpose is to educate you so that you know what your options are and to help you determine if you're a candidate for dental implants. At the end of this video, we have a special free gift we'd like to offer to you, and I hope you take us up on it. But first, if you're finding that your dentures are uncomfortable, annoying, limiting, and extremely frustrating, please enjoy the rest of this video to find out what some happy patients have to say and to find out how you can get a stronger, more confident, comfortable, and attractive smile with practically pain-free dentistry. I want to congratulate you on taking the first steps to find out how you and others can have a stronger, better bite while having a whiter, brighter, more attractive, and more confident smile. I've created this video to educate people like yourself who want to improve their ability to eat the foods they like and don't know what questions to ask, what procedures are available to them, and don't know that with the advancements in technology that you can turn any smile into a 5-star smile that is strong, comfortable, and confident in just a few visits. The greatest thing about all this is it can be done in a pain-free, anxiety-free environment where you don't feel a pinch of pain and you can enjoy the experience. See, I truly believe there's nothing more vulnerable than to walk into a place to purchase something and not know what to ask, request, or demand for that matter. For example, if you've ever brought your car in to get your oil change and that's all you wanted, but the mechanic tells you 10 other things that are wrong with your car. Now, he may be telling you the truth, but the problem is that you don't know if he's telling you the truth or not. The same when you walk into a car lot to buy a car. The car salesman is sizing you up to find out how much you know because they're going to be negotiating a price with you in a minute. If you know what you're talking about, you'll be able to buy the same car for a lot less than the person who walks in and doesn't have a clue. In my opinion, there's nothing more unethical than to sell people what they don't need or want, like in the examples I mentioned, or at prices that are jacked up just because the consumer isn't educated and doesn't know what he or she is talking about. That's why I've created this video, so you can get pretty clear on what you need or want before you ever step foot in a dental office. Are dentists like mechanics or car salesmen? Now, you may be thinking, hey Steve, I didn't know dentists are like mechanics or car salespeople. Well, most aren't, and just like any profession or trade, the majority of dentists are ethical and fair. But even if they are ethical and fair, it doesn't mean they can give you the same quality of advice and service, that they've had the same training, or have stayed up to speed with their education. All dentists are not the same. See, the American Dental Association did a research study where they sent a prospective patient to 12 different dental offices to get price quotes. The prospect was given 12 totally different treatment plans and 12 different price quotes. Some of the quotes were different by over $5,000. So I think it is important to know what procedures you want to have done and what your options are. For example, Betty Johnson is a local resident who came in and wanted 6 veneers put in. That would have cost her more than $4,000 easily. But all she needed was to have her teeth whitened to get the same results. This saved her thousands of dollars, and I hope this video can do the same for you. Following are 3 dangers people with dentures face, and a lot of the common questions people have regarding dental implants, and then there are a few different ways you can get it taken care of. There may be a couple that don't apply to you, just skip over them and pay attention to the ones that do. By hearing these questions and answers, you'll be a lot more knowledgeable and confident when going into a dental office, asking questions, and scheduling an appointment. 3 dangers of tooth loss and poor-fitting dentures that you must know about. Danger number 1, bone loss makes you look older quicker. Dental implants assist you in looking and feeling younger because they prevent bone loss. By preventing bone loss, that would normally occur with the loss of teeth, your facial structures remain normal and intact. The chances of wrinkling and the look of old age before your time is less likely. In other words, every day that you continue to wear your dentures, you are experiencing bone loss, which makes you look much older than you have to. Danger number 2, dentures increase your risk of heart disease and oral cancer. While tooth loss may seem like a small problem compared with other health and fitness issues, it is often the first sign of a bigger health problems for many people and can put them at higher risk for heart disease and oral cancer. When dentures don't properly fit, bacteria can lie in areas behind them and lead to bone disease and oral cancer. Oral cancer is probably one of the least known forms, but the American Cancer Society reports that there will be approximately 30,000 new cases diagnosed this year alone. Then there's heart disease, which has been linked to gum disease. When dentures don't fit correctly, you have higher chance of gum disease. The reason you must be aware of these concerns is because dentures are causing more problems than just being uncomfortable and unattractive. Here are some commonly asked questions you might want to take note of. What are dental implants? Dental implants used by most dentists and dental specialists are root form implants, which basically means that they are replacement or substitute tooth roots used to replace natural tooth roots in areas of the mouth where teeth are missing. Since it replaces the tooth root, it creates the stability needed to have much stronger teeth that stay in place and don't move around. What are the benefits of dental implants? Here are just a few of the benefits. Prevent bone loss. By preventing bone resorption that would normally occur with the loss of teeth, the facial structures remain intact. This is especially important when all the teeth are missing, because the lower 1/3 of the face collapses if implants are not placed to preserve the bone. Overall quality of life is enhanced with replacement teeth that look, feel, and function more like natural teeth. You will look younger and more attractive, which allows you to be even more confident and enjoy smiling, laughing, and talking with others. You can now live longer because you'll get to eat better and prevent malnutrition or stomach problems. Fresh vegetables and fruits are back on the menu. You can now eat the foods you like. Also, since your chewing is improved, your digestion will be even better as well. Increase the amount of enjoyment you get out of eating food. Creates more confidence in social situations. Most patients love their new implants because of their improved appearance, function, comfort, and health. Dental implants will allow you to relax and not have to worry about your dentures moving around, popping out, or gagging you. You'll never worry about your dentures flying out when you laugh, sneeze, cough, or when you eat. Implants are so securely attached that the fear of them falling out will be eliminated. Your mouth will be restored as closely as possible to its natural state. By replacing the entire tooth as well as the tooth root, it is possible to replicate the function of natural teeth with a strong, stable foundation that allows comfortable biting and chewing. Also, nothing in the mouth looks or feels false or artificial. You'll be able to taste foods more fully. Wearing an upper denture can prevent someone from really tasting food, as the roof of the mouth is covered. With implant-supported replacement teeth, it is not necessary to cover the roof of the mouth, so it's possible to enjoy the taste of foods. Improve overall oral health and decrease the risk of oral cancer and heart disease. It is much easier to care for implants of any kind versus dentures, so your chances of bacteria buildup and gum disease decreases when you have implants. Eliminate denture adhesives forever. Since implant-supported teeth are securely attached to the implants, there is no need for messy denture adhesives. Your other teeth will not be affected because of missing teeth. Since replacing missing teeth with implant-supported crowns and bridges do not involve the adjacent natural teeth, they are not compromised or damaged. For example, when you wear a partial denture, you have clamps that hook onto adjacent teeth, which puts pressure on them that causes them to loosen and come out. And bridges require grinding down of the adjacent teeth so that the bridge can be cemented on them. This tooth structure can never be replaced, and the long-term health of these teeth are compromised. Question: who's a candidate for dental implants? Almost everyone that's missing one or more teeth and in general good health is a candidate for dental implant treatment. There are few medical conditions that can undermine the success of implant treatment, such as uncontrolled diabetes. However, here are a few conditions that would keep someone from having implant treatment altogether. Quality and quantity of available bone for implant placement is more often a factor in qualifying for dental implants than medical conditions. However, even people who've lost significant amount of bone can qualify for dental implant treatment with additional procedures to add bone or create new bone. Advances in this type of treatment have made it possible for thousands of patients who had not previously been considered candidates to have successful implant procedures. How painful is getting dental implants? Most patients report they feel very little, if any, pain during the procedure. Also, when you leave the office, you'll get a prescription if necessary. Plus, the doctor will call to make sure that you're not in any abnormal amounts of discomfort. Our goal is to give you stronger, more comfortable teeth with practically pain-free dentistry. How long will it take to complete the treatment? You will notice a difference almost immediately. However, the entire process can take between 3 to 9 months to complete. This depends on the type and quantity of the implants you need, along with the quality of bone in which the implants are placed. There are treatment options that are faster, such as dentures. However, none of these traditional methods prevent bone loss or give the natural look and feel that implants do. Question: will I need to have one implant placed for each missing tooth? No. In fact, it's possible to replace all of the lower teeth with an overdenture that is supported by only 2 to 4 implants. On the other hand, sometimes it might work for you to your advantage to replace your back teeth with an implant for each tooth to provide additional strength. Question: how do I know if I'm too old for dental implants? Great question. Your overall health and your desire to improve the quality of your life are much more important things to look at than your age. We currently have patients from 40 years old to 80 plus years old. There have been reports of people who are in their 90s and having this procedure done with no problems at all. How long do implants last? Most research has shown that implants have been successful for over 30 years. However, our goal is to make so they last a lifetime. This is much improved for the dentures, which are 5 years, and or bridges, where the expected time of use is between 7 and 10 years. Do you offer any warranty? Yes, even though dental implants have over a 95% success rate, there's still a very small chance that they won't completely bond. When this occurs, new implants are placed, and the success rates for the replacement implants are even higher. When we replace the implants, we keep working for free until we get it right. The only thing you need to do is make sure you come in for your regular scheduled visits so that we can keep your gums and teeth healthy, which will prevent most possible problems. What is the cost of implant treatment? Many people call and ask us, how much is one implant going to cost? Well, I wish it was that simple. The only way to determine actual cost is by coming in for a consultation and examination to find out if you have bone loss, if you need 1, 2, or more implants. See, the actual cost of implant treatment is based on a number of factors, such as the number of teeth being replaced, the type of treatment option recommended, and whether additional procedures are necessary to achieve the proper aesthetic and functional results. Does insurance cover dental implant treatment? Insurance coverage depends upon your individual policy. Most policies do not give substantial coverage. Although most companies exclude implants as a covered benefit, many of them will pay the same benefit they would cover for the lower cost alternative treatment option, partials and dentures, and some for the diagnostic records, if a specific request were made for alternative benefits. Danger number 3, dentures may reduce your lifespan. I know this sounds kind of ridiculous because who would ever think that your teeth could have an effect on how long you live? But it's true. Many people with poor fitting dentures or multiple missing back teeth live shorter lifespans of up to 10 years less due to poor eating habits and stomach problems. They tend to eat more processed foods and experience many other health problems related to malnutrition from poor eating habits. People today now have options to dentures, and one of them is dental implants. People who get dental implants can finally eat the healthy foods they've been missing, such as apples, fresh vegetables, corn on the cob, and even steak. What are some common misconceptions people have when choosing a dentist? Misconception number 1. The dentist that offers the lowest price is the dentist you should choose. Maybe, but not always. Here are a few points to consider. Point number 1. The price you see offered may not be for the services you want performed. Before you select a practice, decide what you want to accomplish. Usually, if a dentist is much lower in price than other dentists, it may indicate that they run through procedures faster and spend less time with you. This may not be good because their focus isn't on quality. Also, price is usually an indication of quality. More efficient dentistry may cost more. Better trained dentists who want to give you more time and quality of service cost more. Reliable service and products cost more. You don't buy the cheapest car, clothes, or foods. Don't let price alone be the deciding factor when choosing a dentist. Point number 2. The price you see advertised may not be the price you pay. Many people have learned that the low price they saw advertised was not the amount they were charged. And if you've hired a dentist, you too may have been the victim of false or misleading advertising. You probably learned the hard way that some companies offer a cheap price and then pressure you into paying a lot more once they get you in the office. Some of them may not even mean to do it, but it just happens. You'll find the doctors that operate our denture relief centers are professionals who work hard to earn your trust and respect. As a way of improving the profession, we've dedicated denture relief clinics to educating the public. The only way you can make an intelligent decision is to have all the facts you need. This is why we've made this video for you. If you're thinking about having your teeth examined, whitened, or you're looking for other cosmetic or general procedures, I offer these 3 recommendations. Recommendation number 1. Make a commitment to yourself to get your teeth and gums examined every 6 months. The longer you wait, the worse and more costly it will be. Regular checkups will extend the life of your teeth and help maintain their look and feel. Also, 4 out of 5 people are walking around with the worst silent killer of teeth, and it's called periodontitis, also known as gum disease. If your gums are bleeding when brushing or eating hard food, you have bad breath, pain, or sores in your mouth, gums are pulled back which makes your teeth appear longer, or you see pus between the gums and teeth, you must get in to see a dentist right away. Recommendation number 2. Ask questions. The way you learn about a practice is to ask specific questions and listen carefully to the answers. Here are the questions I suggest you ask. Do you have any testimonials from current patients who are satisfied and enjoy the experience with their dentist? If you're looking to have aesthetic or cosmetic work done, you will want to see before and after pictures of actual patients from that office. Many dentists use books with pictures in them, but the problem is that these teeth are not his or her patients. The second question you'd like to ask is there any warranty or guarantee given? For example, if you bought a washer and dryer, you'd be offered a certain warranty that will guarantee the washer and dryer will work for a certain period of time. And if it doesn't, they'll replace it. Well, in our denture relief centers, almost every procedure has a warranty. So if filling fell out or a crown fell off, they'd replace it for you at no extra charge. The third question you'd like to know is, what is the doctor doing to stay current and keep his or her skills up to speed, especially if you're doing a specialized procedure? See, there are so many dentists out there, and some are better than others at different procedures. So you want to make sure the dentist you choose to do your procedure is very experienced at that procedure. Finally, the last question that many of our patients ask, and I think is very important, is, what does the dentist do to ensure that you are going to have an anxiety-free and pain-free experience? For example, many patients come in very nervous and scared, but find out that they have nitrous oxide, also known as laughing gas. And we can now use lasers to detect cavities where x-rays couldn't. It's amazing how many patients leave our doctor's office telling them how it didn't hurt a bit. By asking these questions and spending the small amount of time necessary to make an intelligent choice of a dentist, you'll help create a doctor-patient relationship founded on mutual trust and respect. Recommendation number 3. Once you're satisfied that you're working with an honest, competent professional, set up an appointment. By following these recommendations, you'll gain all the information you need to make an informed, intelligent decision. If you want the lowest price service, many practices in the phone book can help you. But if you want to get great service by a well-qualified dentist who can service your dental needs completely and thoroughly, creating healthier, whiter teeth, preventing and treating your gum disease, and making your dental experience an enjoyable one, then I invite you to talk to one of the doctors from our local Denture Relief Center after this video. Question: I want to know if I'm a candidate, but I don't want to go to an office that's pushy and tries to sell me. What can I do? Great question. First, here's what we'd like to offer you. A free, healthy, and strong smile consultation from our local Denture Relief Center. Yes, we'll do something your family doctor wouldn't do. We'll provide you an initial interview and consultation with no charge. And no, it won't be disguised sales presentation or a pitch or anything except a brief half hour or so time to get some x-rays, look at your gums and current situation, and find out what concerns you. And simply put, you get to tell us what you want. And that's it. If at the end of the consultation you do not feel like we can help you, or that you don't like us, or that you want to keep doing what you're doing, etc., that's fine. And that's it. You go home and we leave it at that. No pressure, no sales, no hassles. You see, we know a critical fact. In today's skeptical and fearful society, any attempt to pressure someone or sell things before their time is right, or not right at all, will assure the prospect will run for the hills. Believe me, we couldn't be working with so many local residents, near retirees, and retirees if we were doing anything to make them uncomfortable. They wouldn't put up with it for a second. I can't think of a better way to work. Can you? So, why don't you think this over and see if this makes sense to you? If you have any major skepticism left, or maybe have a question or two, feel free to pick up the phone and talk to our local Denture Relief Center professional. You'll find when you talk with them, there will be zero push or pressure. Our goal is to educate you. If you're really not interested or ready, that's great. If you want to talk, that's okay too. You have to understand that we love getting new patients, and as a matter of fact, we get a bunch of new patients every month. But because we have a steady volume, we never accept patients that aren't really excited and interested in their dental future. I'm going to be honest with you. We have so much fun seeing people's lives change for the better when they get their new teeth that we would never work with anyone who wasn't truly excited and looking forward to finally getting the look and feel they've always wanted with their teeth. Life is too short to fight people who don't really want to have a future with more comfort and confidence. I hope you're thinking a lot about your own life and whether or not you feel in control of it with the current dental situation you're in, or whether it's controlling you. Even if we never talk, I want you to begin to take a new view of your dental health, one that allows your natural joy and confidence to be the dominant forces, so you can have the best life possible, and that we have shown you how to get rid of those bad, frustrating feelings. As I said before, there's too much good in life to let worry and frustration about your teeth get in the way. We have qualified doctors available to answer your questions or to have you come in and give you a free Healthy Smile and recommended action plan without obligation of any kind. Here's one last point. I know that many consumers are skeptical about dentists. I'm skeptical as well. So in addition to dedicating denture relief clinics to consumer education, I do one more thing as well. We only work with dentists that warranty their work. That's right, they fully warranty every procedure they do. The crowns, porcelain veneers, and onlays. They warranty for up to 5 years, as long as you come in for your cleanings and treatments as recommended. Our doctors stand behind what they do, and they put their money where your mouth is. If you like our service, like over 1,000 of your neighbors already do, then we want to provide you with high-quality, affordable dental care for years to come. If you don't, then just let us know, and we'll send your x-rays to any dentist you choose. I'm confident that if any other dentist used the same technology we use and attended the same advanced education courses, then he or she will agree with our recommended treatment plan. Thanks very much for watching this video. I hope you enjoyed it as much as I enjoyed making it for you. I hope you found this to be helpful. If you have questions or comments, or if you'd like to schedule a free Healthy Smile consultation, which is usually priced at $197, please fill out the form on this page and someone will contact you shortly to answer your questions and schedule your appointment. Remember, the only way you can get a stronger bite that's more comfortable and confident, quickly, easily, anxiety-free, and pain-free is by finding out what your options are. Please fill out the form on this page while this is still fresh in your mind, and you'll be amazed at how quickly we can have you loving your smile. Thank you.